All right, good afternoon and good morning, and welcome to the Arctic Research Consortium of the United States, where Arctic research is connected since 1988. My name is Bob Rich, and I'm the Executive Director. Thank you so much for coming to our 19th Arctic Research Seminar Series presentation in Washington, D.C., where we're delighted to welcome Roberto Delgado and Andrea Horvath Marques. ARCIS works to connect Arctic research across boundaries through communication, coordination, and collaboration, providing the essential intangible infrastructure required for research to advance. We're a not-for-profit consortium of organizations and individuals working together in support of inquiry, discovery, and understanding of this important region, and informing sound decision-making. This seminar series is designed to provide unique access to some of the leading Arctic researchers and leaders, and for federal officials, members of the DC policy community, and the broader public interested in the changing Arctic. The ideas shared here represent the cutting edge of what we're exploring and learning up north, and also what it means for the U.S. and the rest of the world. ARCIS is excited to be bringing in speakers from the widest range of fields of Arctic-related research in this series. This year, we'll be adding a special program to sponsor the travel of Arctic Indigenous scholars to Washington, D.C. to speak in such a seminar and to meet with key stakeholders here. If you know any Arctic Indigenous scholars who are engaged in this kind of work, please encourage them to apply before the 15th. Details are on our website at www.arcis.org. For those of you in the room here, I'd encourage you to take a look at the ARCIS materials about the different things that we do, including our new brochure. Afterwards, I'd be happy to discuss any questions that you have and love to hear how best we can help you to succeed. If you're online, you can access the information under the Documents tab at the conclusion of the webinar. Whether you're in the room or not, we'd like to hear your feedback on the seminar, so please return the evaluation form if you are here in the room, or after the conclusion of the webinar, please fill out the online questionnaire. It'll just take you a couple minutes, but it'll really make a difference in helping us to plan for future such webinars. For those of you on Twitter, we encourage you to use the hashtag ArcIsWebinar to discuss the event. And so we're currently joined now today by more than 100 registered participants in at least 14 U.S. states and countries. For those of you on the webinar, my colleagues are available to answer any questions that you might have about ARCIS or Arctic research, and to forward to us here in D.C. any questions you have for Roberto or Andrea. You'll have the opportunity to submit text questions by typing your questions in the questions pane of your attendee control panel at any time. Whether you're here or online, we'd invite each of you to become a member of ARCIS. Currently, all types of organizations are eligible to become ARCIS members, including academic institutions, government agencies, corporations, and indigenous organizations. Also, any individual who shares our enthusiasm about the importance of Arctic research can become an ARCIS member. You can join online at www.arcis.org. I'd like to acknowledge our partners in this seminar series, the Consortium for Ocean Leadership, which enables us to use this excellent meeting space, and the National Science Foundation's Division of Polar Programs for major financial support to ARCIS and this seminar series. Now let me introduce our speakers. I'll briefly summarize their many accomplishments, and full bios are online. Roberto Delgado is an active participant and opinion leader in a wide range of Arctic research and an active participant in the ARCIS DC Arctic Research Seminar community. At the National Institutes of Mental Health, he's coordinating Rising Sun, reducing the incidence of suicide in Native groups, an Arctic Council initiative to reduce suicide. He is also a co-lead of the Interagency Arctic Research Policy Committee Health and Wellbeing Collaboration Team, coordinating the efforts of many others in this important area. He's joined today by Dr. Andrea Horvath Marques, who's the chief of the Mental Health Disparity Program, also at the National Institutes of Mental Health. She's trained as a psychiatrist, a neuroscientist, and a public mental health researcher. She holds an MD in psychiatry and a PhD in clinical psychiatry from the University of São Paulo, and a Master's of Public Health from Columbia University. Please join me in welcoming to the ARCIS DC Arctic Research Seminar Series Roberto Delgado and Andrea Horvath Marques to tell us about promoting research on mental health, resilience, and well-being in the Arctic.
There we go. All right, thank you very much, Bob. So I'm Roberto, and I'll get us started today with providing an overview of the context for promoting research on mental health, resilience, and well-being. My slide answer is not working. It was working earlier.
There you go.
All right, thank you very much, Bob. So again, thank you everyone for joining us today on this webinar for promoting research on mental health, resilience, and well-being. Again, I'm Roberto Delgado from NIMH, and I'll be co-presenting with Andrea. The way we're going to format today is I'll provide introduction and context for the work that we're doing at NIMH on this topic, and then Andrea will provide a little bit more detail on specific efforts, and I'll conclude with some additional thoughts and activities going forward. So let's get started. I'll start off with key messages, really sort of the underlying themes that we want to get across based on the different efforts and guidance documents that are available, plus newly funded research projects that Andrea and I will be sharing with you today. Essentially, I think most of us already understand that there are a lot of social determinants that lead to things like depression and alcohol and substance abuse, as well as suicide across the circumpolar Arctic. And it is unfortunately more impacted with Indigenous communities. However, sort of historical research has really focused on negative aspects, what we often call risk factors, and that often is not necessarily the best way to address improving services and mental health among communities, but rather in recent years, there's been an increased focus on using strength-based and community-based approaches, focusing on the positive aspects, what we're calling protective community factors. And Andrea will highlight one of our projects that later in the hour. Lastly, as always, in most or if not all Arctic research seminars, presentations, we've, I think, heard the recurring thing of the importance of collaborations across different sectors. And in an area like mental health and well-being, resilience, that's no different here. You not only need input and cooperation among clinicians and researchers and policymakers, but community members as well. That really is the way forward to improve health and well-being across the Arctic. So what I want to focus on in my introductory remarks is sort of the guidance or kind of just setting the context, the landscape for work on mental health research across the Arctic. And I'll just briefly sort of summarize our efforts during the US Arctic Chairmanship between 2015 and 2017. Where as Bob mentioned, I helped coordinate the Rising Sun Initiative, which was designed to help develop outcomes to evaluate suicide prevention interventions. I'll also briefly mention one of the goals of the report on goals and objectives for Arctic research that is published by the US Arctic Research Commission. I'll also briefly mention the Arctic Research Plan, on which I helped co-author the Health and Wellbeing chapter. And lastly, as a segue into Andreas' component of the talk, briefly mention our new NIH collaborative hubs to reduce the burden of suicide among American Indian and Alaska Native youth. So Rising Sun, some of you may have heard me speak on this topic in other settings. This is just a screenshot from our NIMH website. Again, this was Rising Sun was a mental wellness and suicide prevention initiative following the work of the Canadian chairmanship of the Arctic Council. And in our case, what we did was develop a methodology that included regional meetings, in-person meetings in Alaska and Canada and Norway, as well as an online qualitative consensus and priority setting process to develop outcomes for evaluating suicide prevention interventions across Arctic Indigenous communities. And I'll say a little bit more towards the end as well in terms of the current state of affairs with the Rising Sun. The other important aspect that we're following on in our work at NIMH is based in part on the US Arctic Research Commission's Goals and Objectives report. Goal number 2 in their document is about Arctic health, improving Arctic human health. And this is just broader than mental health and resilience and well-being. Really covers indoor air quality, it covers food security, aspects of nutrition, water and sanitation. And I really commend the Arctic Research Commission in the sense that they not only have sort of put these ideas forward, these goals forward, but have also established working groups, a variety of working groups that are helping to implement and really drive the research forward. So they have a number of working groups. I'll speak to the one that I'm involved in, which is one on Arctic mental health. And this is not a screenshot, but an excerpt from one of their fact sheets stating the aims of this working group, which is about, again, strengthening the systems of care to prevent suicide and improving mental health in the circumpolar north. And this group meets on a quarterly basis to really exchange information about different aspects to improve suicide prevention and improving mental health across the circumpolar Arctic. In addition to the overall working group, there are sub-teams that work on particular areas, including workforce development, data integration, protective factors, and most recently, have created a climate change and mental health subgroup of this working group. And that is another area, of course, I think is very, very valuable and very interesting to a lot of folks, not just who are mental health experts, but folks who are studying environmental and physical sciences, tracking those changes across the Arctic and what those impacts can be, not just on flora and fauna, but local societies as well. The third thing, before getting to and segueing to our NIMH hubs, is just reminding folks, some of you, I imagine a fair number of the audience for this webinar is aware of the Arctic Research Plan that is published by IARPC, or the Interagency Arctic Research Policy Committee, which was published now a little bit over a year, almost a year and a half ago, and covers a broad range of policy drivers and research goals from the life sciences, the physical sciences, the social sciences, and also an important component of Arctic human health. Together with Dr. Tom Hennessy of the Centers for Disease Control Arctic Investigations Program and Dr. Cheryl Rosa from the US Arctic Research Commission, I helped co-author a chapter on health and well-being that really sets out several different research objectives, goals, and performance elements previously recognized as milestones in the previous Arctic plan. I do want to highlight that one of the research objectives focuses on mental health, increasing our understanding of mental health, substance abuse, and well-being among Arctic communities, and that is another important driver of the work that we do at NIH, because in developing the research plan and laying out these objectives and goals and performance elements, we were very clear in terms of identifying what agencies across the federal government with their state and tribal partners would in fact be working towards implementing and achieving these different performance elements. So this is my last slide for the initial introduction. I want to just highlight that we're very excited as a follow-on to the Rising Sun Initiative, as well as to the guidance documents from the US Arctic Research Commission and the IARPC Research Plan. We've recently funded 3 collaborative hubs with the aim of reducing the burden of suicide among American Indian and Alaska Native youth that has several components to it, including partnerships, networks, capacity building, and research. And this will be my segue to hand off to Andrea to come and tell you a little bit more about the specific strategic objectives of the NIMH, as well as more details on the specific Arctic-based hub that we funded. Thank you.
Okay, let me try to see if it works. Okay, thank you, everybody. I'd like to thank first Bob for inviting me to come here. It's a pleasure. I'm not from this, I don't work in the area of the Arctic. I'm just starting, so it's very exciting for me to get to know that better. And I'd like to thank Roberto for inviting me. So I'm going to share with you a little bit about this initiative that is, as Roberto mentioned, follow-up Rising Sun, and we are very excited to be leading this collaborative hubs that the research that NIH is doing in the American Indian Alaska Native communities. Is this the one? Yeah. So just before I go in details on that project, I just want to give you an overview about NIH. NIMH itself, National Institutes of Mental Health, is one of the 27 institutes from the National Institutes of Health. So, and our office, the Office for Research on Disparities and Global Mental Health, is part of the NIMH. And we have a global mental health program, we have a mental health disparities program, and I have a women's mental health program. And we work together in those projects. So I want to, so before just moving forward, remind you that the NIMH mission is to transform the understanding and treatment in mental health, paving the way to cure and prevention and treatment, and then looking from research all the way from basic science all the way to implementation science. Here is our strategic plan from NIMH, and then as you can see here, we are looking to trying to understand the mechanisms of diseases for the mental health, all the way to understanding the trajectories, treatments, and cure and certainly we are looking to have a public impact. So that's one of the our missions, and we are very happy because our hubs are now moving forward towards that mission. And here is our from our office, our strategic plan mission as aligns together with the NIMH mission. In a sense, we are looking forward to understand the mechanisms of disparities, at the same time to develop new interventions or scaling up interventions that we already know evidence-based that can be put into the ground and helping to improve the life of people and reduce disparities. So that's going to be important for us as we describe. So here, as I was just saying, our collaborative hubs that Roberto mentioned aligns with the objective number 3, objective number 4 from NIMH, which is the prevention and cure, and also have a public health impact. And that comes our collaborative hubs. So what we're talking about the hubs, I wanted to just to give you a little bit of background that our office started like working a lot of projects around the world, global and more in the global mental health. And so we have 11 hubs around the world right now. And that started like 8 years ago, and it's just growing. And the experience that we have from the hubs, from all the projects that were and are still going on, being funded by NIH, we bring it back from the experience from around the world, bring it back to US to address a very important public health issue, which it is suicide among American Indian Alaska Natives. And so, and why suicide? No, and I'm just before that, just want to share this. Well, this hub coming back, this hubs has like this 4 major structures that we emphasize. So it's based on a partnership. So partnership is one of the major aspects for all those hubs, and they also have. And the goal is to increase a network between those hubs itself, but not only the hubs, and between expanding the networks around the different partnerships in the universities and nonprofit organizations. In addition, there is a very strong important aspect that we support them to improve capacity building in the areas, the unserved areas. So then after the study has finished or the project has finished, then we'll be able to keep going new research and new projects. So that's a very important aspect. And finally, there's always a research study, a research project addressing different aspects or different questions. So that's our hub, and the hub from American Indians, Alaskan Natives, and the goal was to increase resilience and decrease the rates of suicide and to address a huge public mental health issue. And why suicide? Well, we know that unfortunately in the last 25 years, the rates of suicide in the US has just increased. There was an increase in 24%. And unfortunately, we know that American Indian Alaska Native has the highest rates of suicide, mainly among youth. So that's why in 2016, NIMH designed a new fund opportunity, and that becomes the our hubs. I also want to share with you this data from last year, October 2017. That's a data from CDC. So this study, I'm sorry, this is not the one. This is another review that I want to share with you. There was a systematic review just showing that in Australia, United States, in Canada, and New Zealand, looking what interventions that we have available for indigenous populations. And what this systematic review showed us that there were only few interventions available. None of those interventions were in a randomized control trial. Randomized control trial is our gold standard to provide us information. So that is showing that there is a huge need to have new studies providing us what is the best pathway to help those populations and what is the best intervention that we need to use. This study, this is a report that I was mentioning. So this is a report from CDC. And they were looking at the suicide trends among and within urbanization levels for in 50 states in U.S., including D.C. And what they found out is that the suicide rates is just increasing, mainly in rural areas. And populations, the indigenous population, American Indian, Alaska Natives, the suicide rate is just increasing. So we have to do something about it. And this report is it's important because he provides us like a more strength in a sense of saying we need to be leveraging new strategies and protect, as Roberto said, looking at protective factors, not only about looking at the other side, but how protective factors can be leveraged in those communities that can help to prevent and help to treat. So we, based on those data, NIMH just funded 3 new projects. So they are 5 years projects. So there are 3 hubs, and I'm going to point out to you a lot of them. But I'm going to be talking a little bit more about the Alaska one. So we have one that there is going to be in American Indians in the urban area, the one in Seattle and in New Mexico. So this is looking more at the urban population, American Indians, Alaska Natives. There is one in the rural area for American Indians that is going to be in the White Mountain and Navajo Nations. And there is one in Alaska, the Alaska Native Collaborative Hub for Resilience Research. And those 3 regions that you probably are more familiar than me, they are the highest rate of suicide in U.S. This hub is going to be working on those regions. So this is the hub that we call Anchor. So here I'm just giving you an overview. So their goal is to serve as Alaska Native communities organizations by the federal, state level, nonprofit organizations, different agencies to become a really network. So their goal is to establish a central hub in Alaska to serve all the different areas in Alaska. And their goal is to develop scientific tools to strengthen Alaska Native communities, and they're going to be developing, sustaining a tribal capacity that could be conducting research and following up after that research project is over. And as I mentioned, so it's going to be a 5 years project. It has just started in August last year. So as I mentioned, we are basing those 4 major principles and partnership in this project. This group has been working in this area for many years, and they have strength partnerships in these communities. And as I mentioned, we're going to be targeting those 3 communities. That's where the study is going to be starting. And here you can see the rates of suicide on those communities is huge. No, so we are really glad that that's where we're going to start, and that we're going to be able to provide some help pretty soon. And the goal also is to broaden, not to be only on those communities, but these regions, but definitely to be extend that to other regions in Alaska, and why not to the Arctic as possible. And this also, as I said, we are another important aspect is the network that they're going to be doing, and how they're going to be building capacity in that region. So Fairbanks, Alaska, University of Alaska, Fairbanks, and Anchorage, they're going to be working together. And they're going to have a cross-camp discipline collaborator programs where students going to be going from those universities, one to another one, to increase and in a multidisciplinary fashion, they're going to be developing programs and how to address and to be learning the next steps. And the goal is to be mentoring them to be doing their master's and PhD projects. Also to be learning a little bit more about mental health research. And we are definitely, and they are encouraging native careers investigators to be working with them. In terms of the research project itself, this group has emphasized in a community level factors, determinants of health. So they're going to be using what you call a mixed method approach to determine what are the community level factors that are going to be associated with increased resilience. And they're going to be starting this study looking at 64 rural villages around Alaska in those 3 regions that I mentioned. They're going to be evaluating the association of these community level factors with suicide, and they're going to be trying to understand what is the mechanism associated with that. And then they're going to be, their goal is to develop and disseminate a friendly, use-friendly tool that they call Alaska Community Resiliency Mapping, and the goal is for them, after they have that tool, that they're going to be able to disseminate around different regions in Alaska. So that's a little bit about our project, and I will be happy to answer any questions. But we are really excited, and we're just starting, and I'm really excited to learn more with you all. Thank you. Roberto's going to be coming back to finalize.
Well, tag team action here. I actually want to take a step back with respect to Anchor and just emphasize that, yeah, this is a very exciting project. I was just in Fairbanks last month for the kickoff of the Research Steering Committee meeting. I forget if Andrea mentioned the leads on the project. They include Dr. Stacy Rasmus from the University of Alaska Fairbanks Center for Alaska Native Health Research, Dr. Jim Allen from Minnesota, University of Minnesota, and Dr. Lisa Wexler from Amherst, Massachusetts. All of those fine investigators have been working with Alaska Native communities for decades. And so that was another really key aspect of the project. In fact, 2 of the 3 hubs that were funded are being led by Indigenous scholars who have incredible relationships, trust of Alaska Native and American Indian communities, which is always a really, really key factor, especially on something very sensitive like mental health or mental illnesses and suicide research. And so we congratulate all our PIs with respect to the proposal that they put in, but the work that they propose and are beginning to do at this point. I'll just say briefly, when I was up there last month in Fairbanks, it was really, really astounding to be there in person and meet with tribal and state partners to the project. Again, it's a very, very collaborative proposal, a collaborative research project. Very ambitious. They have a lot of work to do, but it's all very, very exciting. And they propose to have a collaborative hub meeting later this spring, which I hope that some of us will be able to attend, and maybe folks up in Alaska also who are interested in this topic can participate at. So once more information is available, we'll be sure to distribute that. Also just want to add another comment based on Andrea's remarks earlier about the hubs model. She began by saying that our office, half of our office is global mental health, And the work that we've been doing, yes, over the past 8 years or more, in low and middle income countries have really served as the foundation for the hubs that we've established, that we've funded here in the United States with American Indian Alaska Native communities. Initially, there were 5 collaborative research hubs to improve interventions, mental health interventions across low and middle income countries. And more recently, we've funded 11 scale-up hubs. So based on the initial 5 research hubs that found important evidence, mostly around task shifting and community health workers providing sort of initial first aid mental health, that really served as a basis for the scale-up hubs, which have been funded in the past few years. And again, these span regions in Latin America, Sub-Saharan Africa, the Middle East, Central and East Asia. So really, really dynamic and geographically broad aspects of the research. And I don't think we can't emphasize enough that aside from the excellent research that is being funded both globally and domestically, that capacity building component is really, really key. I think a lot of researchers talk about sustainability and ensuring that host country, or in this case, local communities, are also trained in the skill sets to improve, in our case, the health and well-being of their communities, or in other cases, their understanding of environmental and physical changes in their environment. That research capacity training is really essential. And so I was very excited to hear about the ARCIS Indigenous Scholarship Program as well, sort of promoting that exchange and that outreach. So again, I think wonderful things that are happening across the Arctic in many different sectors of research. So in my concluding remarks, sort of just take a few minutes to highlight additional things that are ongoing at NIH and across HHS, the Health and Human Services Department. One of the things that we're very excited about is the Tribal Health Research Office. So in last year, early 2017, there was Dr. David Wilson was named as the director of the Tribal Health Research Office. He came to us from HHS Office of Minority Health to be a coordinator across all of NIH. Andrea mentioned 27 different institutes and centers and offices, very focused on different aspects of biomedical research. But having this one office sort of be the liaison with the rest of the government, with non-federal partners, with states, and tribal communities and tribal councils, really, really key aspect. And so the Tribal Health Research Office sits within the Office of the Director at the NIH in a division whose acronym is DPCIPSI, if I'm saying that correctly, the Division of Program Coordination, Planning, and Strategic Initiatives. And so it has a high-level profile, which is excellent. I happen to serve as the NIMH representative to a Tribal Health Research Coordinating Committee that was put together by Dr. Wilson and the Tribal Health Research Office. And the great thing about the Tribal Health Research Coordinating Committee is that, again, it brings representatives from all the different ICs, whether it's mental health or drug abuse or alcohol abuse and alcoholism, Cancer Institute, minority health and health disparities, you name it, every center and every division or office is represented here as a liaison to ensure improving American Indian Alaska Native health research. And so in just a year, it's been about a year since Dr. Wilson started. It's been tremendous level of energy and activity. This slide shows a few of the main things that I've been focusing on, including development of a strategic plan, also first ever NIH-wide American Indian Alaska Native research portfolio analysis, and also just getting all the different centers communicating, talking to one another on a regular basis about the health-focused research, improving that of American Indian Alaska Native communities. Also, the coordinating committee in the office serves as a liaison with tribal advisory committees, also helps to coordinate Secretary's Tribal Advisory Council sessions as well, and consultations, tribal consultations as appropriate that are requested by different federally recognized tribes. And so, for example, I think I can say that that there is a tribal consultation proposed on the opioid crisis, which has a lot of overlap with substance abuse and mental illnesses, including suicide. And so that this office is really kind of the forerunner for all that engagement with American Indian and Alaska Native communities. So folks interested in other aspects of health, not just mental illnesses, please reach out to Dr. Wilson. He's very, very excited. He has some staff members who are very, very energetic and motivated to really assist these efforts across American Indian and Alaska Native health. The other main thing that keeps me busy, so Andrea mentioned that our office does quite a lot, different programs, global mental health, we have minority health and health disparities work, we also have a women's mental health program, and we also have a rural mental health program, which is little known, but is congressionally mandated. And I'm now the lead for our rural mental health research projects, and as Bob mentioned in the very introductory remarks, I'm also one of the co-leads of the Health and Wellbeing Collaboration Team for IARPC. And I do so with assistance from Dr. Tom Hennessy again from CDC in Alaska, and also Sarah Yoder from the Alaska Department of Health and Social Services. And together, we hold monthly meetings to report and exchange information on the different performance elements and research objectives of the Health and Wellbeing Collaboration Team. We're about to be holding a team leaders workshop in the coming weeks here in Washington, where we are planning for the next year. And one of the things that we really want to expand on is collaborating with other collaboration teams. So a lot of collaborations, principally teams including terrestrial ecosystems, atmosphere, coastal resilience, and others as appropriate, because there are, I don't know how many have actually looked at the Arctic Research Plan, there are some mutual goals that are identified in different chapters for different collaboration teams. And so those of us who are a little bit more, I guess, wonky in the sense of being involved as co-leads of these collaboration teams or having helped produce and write the plan are starting to really, again, increase the cooperation and the exchanges with other collaboration teams to make sure that we are collaborating, coordinating as best as possible for mutual benefit in achieving these different milestones and performance elements. So I think we've gone a little bit quickly today. We apologize for that if things haven't been absolutely clear. I'll wind down just by saying that there are increasing opportunities this coming year for additional information dissemination on different mental health and well-being topics for the circumpolar Arctic. One is that ever elusive, very much delayed Rising Sun Toolkit that we are close to completing. As I mentioned, the Rising Sun Initiative was a priority one of the priorities under the US Arctic Council Chairmanship over the past 2 years, and I was one of the coordinators for the US government on that initiative. We had co-sponsors from Canada, the US Circumpolar Council, Norway, and from Denmark that were very, very helpful in meeting, or at least, yes, in meeting the goals of the initiative, which again was to develop outcomes, community-based and prioritized outcomes to help evaluate suicide prevention interventions. And so we did submit an activities report at the ministerial meeting last year, but it's been taking a while to fully implement or fully produce an online toolkit, which was another component of that initiative. And so actually we're very close to completing that. This is going to be hosted by the Mental Health Innovation Network, which is part of the London School of Hygiene and Tropical Medicine. And so again, that resource will be forthcoming. It will have a bit of context, background on suicide prevention landscape across the circumpolar Arctic, some examples, some case studies of effective interventions that have been widely implemented, as well as the results of our outcomes, and also some guidance for different stakeholders or end users on how to use those outcomes. So again, thinking about those outcomes and those end results, it could be used in different ways depending on whether you are a policymaker, whether you are a researcher or a clinician or Alaska Native community member or Arctic Indigenous community member. And so we want to ensure that we have some guidance for members of those different communities, those different sectors, and ways of how to utilize those outcomes to improve the interventions for suicide prevention across the Arctic. Another exciting upcoming event for this summer is the 17th International Congress on Circumpolar Health. together with colleagues from the Inuit Circumpolar Council and the Sustainable Development Working Group of the Arctic Council, which sort of was the overarching manager of the Rising Sun Initiative. We have put in a session proposal to address circumpolar suicide prevention and resilience, which are being led by Circumpolar Council groups and SDWG, or Sustainable Development Working Group members, including myself. So there will be additional presentations during that session, if accepted, about the great work that the Inuit Circumpolar Council has been doing in Canada and Alaska, as well as sort of follow-up activities from Rising Sun, not just here in the United States, based on our American Indian Alaska Native Collaborative Hubs, but there are some new proposed activities that the Inuit Circumpolar Council in Canada are putting forward during the latter part of the Finnish chairmanship of the Arctic Council. And other thing, just to remind folks, we go back and forth, we go global, we go domestic. Another activity in which I'm engaged in on behalf of our office is the 4th National Climate Assessment, or NCA4, which is scheduled for publication later this year. Right now, it's finalizing the peer review. We've received the public comments at this point. I'm a federal co-author on the Tribal and Indigenous Communities chapter and have included a small section on mental health. And so we're in the process of revising these drafts and making sure that there'll be a secondary round of public comment, of course, before the final approval, review, and publication later this year. But I want to add that there are a couple other chapters, namely the Alaska chapter, the regional chapter, and also the human health chapter that includes aspects of mental health, well-being, and resilience. Alaska obviously is the most pertinent to the Arctic context. The human health chapter does not necessarily sort of explicitly address Arctic conditions, but certainly, a lot of the impacts are going to be comparable to the health outcomes for communities who are undergoing rapid climate change, whether you are in the Arctic or elsewhere. So with that, just a couple of last-minute reminders as well. We at the National Institute of Mental Health convene an annual global mental health workshop, co-sponsored or co-hosted rather with Grand Challenges Canada, who has been very, very involved in some of our global mental health work previously around different mental illnesses and interventions. So if any of you will be in the Bethesda area in early May, we welcome you to attend our global mental health workshop. So this is your save the date. I will be posting additional information, details on the IARPC website. I'm sure we can get it out to Arctic Info and the usual suspects of dissemination. Here, the topic for this year is going to just focus around diversity and interventions and translational services. We propose to have sessions on research and policy engagement, and also, again, given our more recent work with Indigenous communities, both across the circumpolar context and in our global mental health portfolio, we are also proposing to have some sessions focused on Indigenous peoples and mental health, and hopefully there'll be an Arctic component as well. And we hope that some of our American Indian Alaska Native Hub PIs will be able to attend and participate if their schedules allows. And so with that, I'll wind down now. Just saying, here's our contact information. Andrea is our Chief of Minority Health and Health Disparities in our office. I've recently been named Chief of Rural Mental Health, where, again, I really strongly feel that the Arctic context is going to be a key aspect of that work because it's so integral. It really brings together our global, our rural, our disparities portfolios in one nice integrative sort of I don't know, I'll say bubble, but a nice sort of component together. It's very synergistic is probably a good word for it. So yeah, I really want to thank again ARCIS for inviting us to present, for Andrea and joining me. I'm trying to get more people in our office and across NIMH to be involved in Arctic research. And also, I shouldn't forget that our American Indian and Alaska Native Hubs are also co-funded by NIMH, the National Institute for Minority Health and Health Disparities. And so with that, yeah, I'll conclude, and we're open to entertain questions now. Thank you very much for your attention.
Thank you very much, Roberto and Andrea. Great presentation. I've got all sorts of online questions here. For those of you who haven't yet put your question in, feel free to type them into the chat box. And anybody in the room have any questions? We'll start with one online then. I have a question here from Guillermo Ayad from the Bureau of Ocean Energy Management. He says, is youth resilience specific to each youth, for them as a community, or both? And can you elaborate on the youth resilience model?
You want to come first? I'll go ahead and start. Thanks, Guillermo, for that question. So resilience is individual. It is community-based. It depends on what type of resilience you're talking about. And I've sort of struggled with this on a personal level in the sense that I come from, some of you may know, I come from an evolutionary ecology background, and I think of resilience and adaptation in slightly different ways. Yeah, individual youth can be resilient, but we often talk about communities. So at least the focus of the Anchor project is more of that community-based protective factors. One of the aims, again, is about developing a community resilience model. So one of the first aims is going around to the different villages across Alaska, rural Alaska, and doing some surveys, some qualitative surveys, identifying what are some features, whether they're infrastructural, social, services-based, with respect to what is available in a community, and then mapping those out and determining, what are the rates or the incidence of different health outcomes, and determining, what are the strengths-based ones, the protective factors, and understanding that when you have these correlations of, positive or more services and positive relationships and other enduring factors, that those are associated with positive outcomes, then that's one way, that we measure or can quantify resilience. Andrea, you want to add something?
Can I? Yeah. Thank you, Roberto. I think here Roberto mentioned a lot about also the importance of looking at those community levels factors that could be associated with resilience. And this project is one of the main points is looking on that also. But as you were saying, individual levels of resilience is something in our more a biological perspective we are also studying, because as we understand, it's probably is not like the same biological pathway what we call resilience and what we call disorders or disease or symptoms. So there is a lot of studies also trying to look in a more biological pathway. This study is looking like more social determinants of health and looking at determinants of community level and individual level. But there is also research on resilience in a more biological level that I just want to add to this.
Great, thank you. Actually, a related question, and this comes from Corey Erickson. Essentially, the question is, what is the origin of the dramatically high suicide rates in the Arctic communities, or is it too early to tell?
Good question, Corey. Thank you. So it's a variable, and that's something I think we probably didn't emphasize enough when Andrea was going over the rates of suicide in American Indian Alaska Natives. And if you see actually similar patterns across circumpolar Arctic as well, there was a review a number of years ago that looked at populations in Greenland and Russia and Scandinavia that also showed that those regions, particularly with high population densities of indigenous community members, tended to have higher suicide rates. And so if you look at sort of the metadata, it looks really bad. But when you start diving down into more fine-grained levels, you actually know that there's a lot of variance. And some villages or some communities have relatively high rates, and it's hard, sometimes it's a challenge because these communities are a few hundred people, and so the extrapolations make it seem exceedingly high, and of course any suicide is too many. But it kind of throws off the numbers. But then you also look at neighboring communities close by, and they may not have had a suicide event in decades. And so it's a bit misleading to say, yes, all indigenous communities have really high suicide rates. So there is variation. That's one point. Getting to the crux of the question, though, it varies. People have hypothesized historical trauma. domestic violence, substance abuse, lack of socioeconomic opportunities, and the weight of these different factors varies from community to community. Those are just a couple. Andrea, you'd like to add?
Yeah, no, I think you mentioned exactly. We even in not only Alaska Native communities, but in the American Indian communities, the rates also varies a lot. So one of the goals is to, when you're looking and studying and trying to understand why it varies, and in that sense, also looking what could be helpful to as a protective factor to help to translate for other communities is important. So we are still have more questions than answers. That's why we are looking for more research to help those communities.
Great. So is there an exchange of information between the different research activities in Alaska, Canada, Greenland, and the Alaskan Native programs? And this question is from Astrid Surmats. So is there an exchange of information on a regular basis?
So I would venture to say that there is not, and that it's more piecemeal or happens on occasions. So I can't sort of think of a sort of truly circumpolar wide group or network other than there is an Arctic human health expert group as part of the Sustainable Development Working Group of the Arctic Council, but has a broader mandate, not just around mental health and suicide. The Inuit Circumpolar Council is very active in Alaska and Canada, parts of Greenland, and parts of Russia. So for that particular Indigenous community, there's really good information exchange. Domestically, I think the Arctic Mental Health Working Group of the US Arctic Research Commission is becoming that. But no, other than these sort of annual meetings at the Congress for Circumpolar Health or through some of the Arctic Council initiatives, there isn't sort of at least not a consistent, unified, good sort of network of exchange. And that might be something to think about for different groups, whether it's an IARPC, an Arctic Council, an ARCIS, or other relevant body.
Great. So a question from Diane Hirschberg in Anchorage. In health and well-being, is there any involvement of education in the work that you do? Anyone exploring the effects of formal education institutions or non-institutional sharing of local and Indigenous knowledge on mental health and well-being?
You want to try? I can start. Hi, Diane. Thanks for tuning in. Diane was in Fairbanks last month. So the quick answer is no, unfortunately. And I know this was a question, and I think Diane, you were one of the people who brought this up during the writing of the Health and Wellbeing Plan chapter for last year, actually 2 years now. Unfortunately, based on the agencies that were involved in implementing the plan, the closest that we sort of came to was discussions with the Smithsonian Institution. We're trying to get some of their efforts involved into the plan, and but unfortunately the short answer is no, and I'd be interested in maybe talking about that further for next annual plan of the Health and Wellbeing Collaboration Team. So,
any questions
email me,
in the room here? I have a question here from Catherine Madsen. Can you say more about how the collaborative networks actually work with young people? How does a network reach a young person in the very deep isolation in which he or she is considering suicide?
Well, I would say that those projects are just starting right now, and the goal is to be able to connect them in a sense of having resources that are going to be available to connect those different communities and to disseminate the findings more and more available for different communities for them to adapt for each one of them. So I would say that we're going to learn more how that network is going, but they were sharing with us how they were looking forward, because as you all know from working in these areas, how spread those communities are and how the need it is to bring an efficient network. So I would say wait a little bit, and we're going to be able to share with you more information on that.
Do you have a time frame of when you think these various hubs and so forth are going to start having sort of tangible results coming out of them?
That's a good question. These are all 5-year projects. So they are just right now in the formative stages of their research and developing and finalizing their protocols and getting their different IRB and tribal council approvals. It might be a couple of years, to be honest, and just the nature of the work is challenging, particularly with the Anchor Hub, in that they want to survey 64 villages, I believe, over 60 in the coming year as just the first aim, and it has they have 3 aims, and so each of the subsequent aims builds on the previous one. And many of you who have conducted research in the Arctic know the logistics and the challenges of collecting data out from communities across the year, and so it'll take time. We're in no rush. I mean, we're committed for 5 years and hopefully beyond that. And so is the state and the majority of tribal partners that have signed on. And I'll just add on the question about how do you engage and network with youth. That's a challenge too, and it varies. But I think all of the hubs, the 3 ones, not just the Anchor Hub, but the Urban Hub and the one in Southwest, are really committed to including Native youth, American Indian Alaska Native youth, as part of the projects. We were already talking to some of these hubs about diversity supplements, so that we can train young youth, American Indian Alaska Native youth, to be helpful and productive members of their communities in this context.
Yeah, I just also want to add that although it's going to take 5 years for us to see the final results or even more, but certainly we're going to be learning as time passes by, and we're going to be able to share. And so we're going to have a website for those hubs, and you are welcome to sign on for our newsletter, and you can be having access for the new information that we're going to share. What we really want to do, and NIH also want to be part of this network in a way to help to disseminate information and experience. So soon the website is going to be ready, and I welcome you to sign up on our website.
All right. Well, I think we're running out of time here, so thank you again. Oh, we have a question in the back. Okay, Asma, one more. Yeah. Oh, can you press the button on your microphone?
Oh. So what are some of the examples of intervention, on-ground intervention, and how do you know if somebody's going to relapse? After 5 years, like how do you measure success that, I stopped this youth from suicide forever, or, I mean, not forever, but. This project here, it's not and it's not testing any intervention right now. What they're trying to their goal is to develop an intervention based on the results what they have, looking for they are having a survey looking at the factors that could be associated with risk and associated with protection. So, for instance, the other 2 hubs we have that are going on, one in urban areas and one in rural areas, they are testing interventions. One of them in the rural area, they are testing interventions. They are was already pilot in their communities, and that they are based on very based on their culture, their adapts, and how we're going to be measuring the outcomes in a sense of, so the outcome is not only suicide rates, but because also that takes a long time in a sense of numbers, but also suicide attempts, suicide ideation, suicide behaviors, adverse outcomes. So we can track those information. And what is important about those projects is that those 3 projects, they are already being embedded in the community, those researchers, and been following them, those groups. So we're going to be able to follow them up, because definitely we need to know if it's working or not. No, so we are looking to see those results and how can we disseminate and learn from that.
All right. Well, thank you very much. Why don't we join together in thanking Roberto and Andrea one more time?
Thank you.
Just by way of a few brief concluding remarks here. I wanted to invite you to our upcoming research seminars that are coming up. On March 6th, Maureen Laurel from George Washington University will talk about the Russian dimension of Arctic research. And on March 29th, Matthew Jewell from University of Virginia will talk about Arctic architecture. We, as has been mentioned several times now, we have a new Indigenous Scholars Program. Please encourage those you know to sign up for that. We are going to be holding, if you happen to be in Anchorage, mark your calendars for April 26th. It'll be the second annual Anchorage Arctic Research Day. Great opportunity for people to meet face-to-face from throughout the diverse Anchorage Arctic research community. In June, we're going to be celebrating the 30th anniversary. ARCIS has been around since 1988 at the Polar 2018 conference in Switzerland. With that, I wanted to thank you all for participating. Please fill out the evaluation surveys either online or that you've been handed when you came in here. And feel free to stick around if you're here in the room. We have cookies, we have beverages, encourage you to get to know each other, get to know our speakers. And thank you very much, and I hope you have a great rest of your day.